Welcome to Shaping Healthcare, a podcast by CitiusTech. Some of the great minds in the world are constantly striving to solve the healthcare industry's greatest challenges with technology, creativity, and agility. With every episode of the Shaping Healthcare podcast, we will take you deeper into the world of healthcare and life sciences and give you a perspective into what it takes to build a human-first, technologically enabled healthcare world. I'm your host, Laurel Rockel. Joining us today is Dr. Neha Kanwar, the current Assistant Vice President at CitiusTech. Neha has garnered over 17 years of substantial experience in the healthcare and life sciences sector, dedicating her expertise to ensuring a successful digital journey towards the healthcare of the future. Before her ongoing tenure at CitiusTech, Neha has held leadership roles at Atos Intel, contributing significantly to the life sciences practice and strategic marketing. With a solid background in both pre-sales and delivery, she has been instrumental in managing end-to-end go-to marketing strategies, showcasing a profound impact in sales growth and marketing penetration. We also have John Janney Jr. with us, a seasoned transformational healthcare marketing, operations, and technology senior executive. John currently leads as the executive practice leader at FluidEdge Consulting, a CitiusTech company where he spearheads transformative consulting engagements with C-suite executives of premier healthcare companies. With an illustrious career, John has earlier served as the SVP of Transformation at Independence Blue Cross and AmeriHealth Administrators, managing multiple divisions and leading an $80 million strategic project that significantly enhanced healthcare BPO capability. His expertise lies in orchestrating operational efficiency, process design, and technology integration, making substantial strides in healthcare transformation. Neha and John, welcome to the podcast.
Thank you. Thank you for having us.
Look forward to it.
Yeah, look forward to having a great conversation with you both today and bringing your experience and your expertise to this conversation. And with that, as we embark in a discussion on generative AI, I want to start with the vision and have that be the backdrop here for a moment. And for each of you, what do you see as the overarching vision for generative AI in really redefining the healthcare landscape, especially when it comes to a payvider perspective? Neha, we'll start with you.
So from the payvider perspective, generative AI holds tremendous potential. First and foremost, the technology itself has the potential to not only understand, generate, but also learn from complex healthcare data. There are three kinds of impacts that I primarily see from the payvider perspective. First is in terms of automation, wherein the software has the capability of automating tasks which were difficult to automate in the past. Secondly, in terms of acceleration of the overall life cycle, in terms of the innovation that any payvider is going after, it accelerates the entire process and shortens the innovation life cycle for a payvider. And thirdly, in terms of augmentation, which brings in the human productivity aspect, which generative AI holds tremendous potential of augmenting. Now, if you see the payer life cycle, it has potential impacts across the entire life cycle, right from when the payvider would want to market or sell its products. Generative AI helps bring in the content generation piece of it, wherein it helps generate personalized marketing campaigns or personalization of information. Any kind of communication that needs to happen between the payvider as well as the member or the patient is highly personalized in this case. Next, moving to the contract generation piece of it, wherein generative AI plays a big role in terms of analyzing, understanding the past contracts and generating new contracts for payviders, which is a big area of impact again. Moving on to the middle office, aspects of whether it is medical coding or clinical reviews, coming in from the eligibility as well as the prior authorization aspects, wherein there is a lot of summarization of medical information that is required from the patient documents. It helps clinical reviewers in assessing those documents as well as providing those right recommendations, whether these are medical necessity information is available within them. It compares with the payer guidelines in terms of recommending whether this can be authorized or denied for authorization. Clinical coding assistance as well as a CDI piece, wherein it helps administrative staff in assigning those right codes. It helps evaluate the unstructured data from the medical documentation of patients and helps recommend the right codes to be assigned or the charge entry to be done for a particular patient documentation. Moving to the back office functions, wherein it not only helps call center operations, but it also helps the administrative staff in claims adjudication, management of claims, validating whether the claim information is correctly present within the documents, and also recommending whether the claims can be approved or denied. Coming to the denials management piece, again, from the payvider perspective, which is a big area, understanding what would be the possible root causes of denials. It goes one step ahead from what the regular AI technology does in terms of, building in information from pre-fed models or, machine learned models to deep learning as well as neural networks that generative AI utilizes. And hence the entire payvider value chain, right from, not only improving the experience of an administrative staff, but also the overall experience from the provider, payer, as well as the patient perspective is what generative AI holds today.
You use the word tremendous, and tremendous it is. That sounds like a lot of a lot of value and a lot of a huge role that it really could have in that perspective. That's beautiful. John, what are your thoughts on that?
So Laurel, what I'm struck by, I think back over my 30-year career as an executive in health plans, and of course, payviders are merely hospital-owned health plans. And if I had $1 for every time some technology firm came in and said, this is going to revolutionize healthcare, it's going to change everything about our jobs, I'd be a very wealthy man. The reality, though, is this one really could revolutionize healthcare. And let me explain why. Part of the challenges with the technologies that have come before is that they really depended on structured data and the ability to get data in a format that could then be consumed. The promise of AI to me is that we all recognize the complexity of healthcare. We all recognize that it uses massive amounts of information and data and connection points, far more than a human brain can possibly process at any given time. But where AI now offers the opportunity of real change is that it will take unstructured data. It will take that unstructured data, find a way to understand that data, and then create the connection points that heretofore were really, really difficult to do. And, as Neha pointed out, in all of the various areas of a health plan's operation, front, middle, back office, that all of those areas have that as a core problem they're trying to solve. Now, all is not easy, right? Because even though these tools can take unstructured data, what every executive has to be thinking about is, well, what am I teaching my new capability? Is my unstructured data accurate, or will that unstructured data in and of itself yield results that are suboptimal? And this is where, there's a significant opportunity for plans to make an investment and say, you know what? We're really going to leverage and embrace these new technologies and these new capabilities, but we're going to do it with an eye towards making sure we're feeding it the most accurate information that we can provide.
Absolutely. I think, AI, artificial intelligence, I think there's sometimes this thought from some people that, in addition to just the hype around it, of course, there's that thought process of it's almost like a human brain, but it's only as good as the information that you're putting into it, right? As you mentioned, and that data that goes in is, all your results are dependent on the data that's going into it. And I'm so glad you bring that up, because it's obviously a very, very, very important aspect to think about. And, how can we guarantee like the data that we're putting into these AI models, especially when we're looking at, health benefits, provider data, is of the highest quality?
Well, guarantee's hard, right? Because you probably can't guarantee, but what you can do is put the right level of focus and programs in place that validate what you're feeding your artificial intelligence. But I always go a level above that, right?
Sure.
If I were working with a client that was a payvider, and they said, John, we have all these firms coming in and pitching to us, the next great AI solution for our company. How do I evaluate that? What do I do with that? I'd say the good news is it really starts with evaluating what are you trying to do? What's the problem you're trying to solve, right? What is your end vision that you have for this? And that vision has nothing to do with AI. That vision is just your vision, right? So you might say, look, my vision is I want to significantly improve the quality of the information that I provide to members or providers who contact me on the phone. Great, we can work with that. We can figure out how the data that you need to provide to that will provide repetitive or consistent, not repetitive, but consistent answers to the various questions or problems that are presented to you. And we can also make sure that you're using tools like AI in the right way.
Right. Just to add, Laurel, in terms of the data quality, which is of primary importance for any generative AI model to, get those kind of outputs that the organization is looking at. The quality of data has to be, without any gaps. It has to be standards, following a standard format, as well as diverse in terms of, capturing the kind of population that the model is going to be trained for, or ensuring that the data used for that AI particular model is diverse and representative of that patient population. So biases often, stem from the fact that there are gaps in the existing data or the data is skewed. So all those can be avoided if we take data which is diverse as well as, maintaining the quality of data. So that is like the primary starting point for any generative AI solution to be gotten into a provider or payer organization. And secondly, in terms of, developing that entire model, we need to have some ethical guardrails also in place in terms of, following PHI or, those regulatory standards that are required for any kind of a solution, whether it's HIPAA, high-tech, or any local data privacy and regulatory guidelines that need to be followed. So most of the providers that we see today are, investing in solutions which are low risk, but are medium to a high impact kind of areas. So those are the specific ones which are of target, which would have the right kind of data to be supported for and, to be basically implemented within the organization.
I'd add to that, but if you think about the fact that, again, as I said earlier, perfection is not what you're after because it's too expensive, right? And so don't think of these new capabilities and as capabilities that will replace our need to think or our need for skilled people. Think of, the term I like to use is think of them as co-pilots. They're a co-pilot with you, right? They're allowing you to have access to information that today you could probably, if you had an hour to research and pull it all together and organize it in an effective way, you could answer the question in the same way. But the beauty of something like a well-designed AI is that that's giving you that information in a few seconds. So now you're in a position to basically do what would have taken you hours and hours, maybe a day of research and design and planning and layout to basically effectively answer a question. You're presented that. Now, you may filter some of that and say, this doesn't apply. Maybe this is not the answer that is most effective, but it can be a really powerful aid to helping you do your job.
So generative AI is called as a trusted ally to whether it's a provider, whether it's a peer or a call center agent. It's an ally to them, and replacement of humans is nearly impossible. Even with generative AI coming, because the kind of validation of the output that needs to be coming in specifically from the healthcare perspective, because healthcare is an industry which is so regulated and it is so patient centric that the validation of the output is much required, and that is where humans are required.
Yeah, I love the analogy of the co-pilot. I think that's great. I've used the analogy of like a toolbox before, and I think that I like the co-pilot better. I really love that example of the co-pilot, and I think that is a really important analogy for people to hear, because I think there is that maybe a little bit that panic or worry of there's replacing that's happening, or people getting replaced by machines or by computers. And I think it's when we look at it as a tool, as a co-pilot, as an ally, as you mentioned, to help our jobs and help make us more efficient in what we're doing and faster. I think that's a huge and very transformational way of looking at it too. And so I kind of want to rewind a little bit here. I want to kind of present to you a big burning question of the day here. And that is that healthcare costs are going up. They have steadily been rising over the years in the United States, and it's affecting both health insurance companies and also the consumers. Just it's more expensive all around. And so we've definitely talked about it a little bit, but what role does generative AI have to play here? What solution can it help solve in this problem or bring to this problem?
From my perspective, when we talk about the high cost of healthcare, obviously there's a lot of opportunity to point fingers, right? We can say, hey, the health insurance companies have made the process onerous and difficult, and therefore, they build administrative cost that is unnecessary into the process. We can point to the government and say, with this sheer amount of regulations and the different regulations from state to state, they've driven cost into the system. And we can point the finger at the health providers to say, they're whether it's a drug company or a physician or a hospital system, that they're charging too much for their services. And all of those, frankly, are legitimate topics. When I think about it, though, from and where AI, I think, really shares promise, certainly it can help on the healthcare side with the 10% of cost that is tied to administration, that it can help reduce that down. But where I really think the value is going to come in is if you consider the fact that a John Hopkins study identified that about 250,000 deaths occur every year in the United States due to medical mistakes. These are not bad doctors, bad nurses. These are just, you're dealing with tons and tons of things that can go wrong and imperfect information being available to them at the point of treatment, sometimes not sufficient time to really reflect as to what's the best course of action. That's a lot of cost, right? That's a lot of bad outcome in the system. And if you accept those numbers from Hopkins, that they are accurate and that they're sort of the best, I think, study that's available right now on that point, the next question would be, and how many situations occur where the patient is actually affected? Maybe they aren't killed, but they wind up having to stay longer in the hospital. They wind up being sicker and not able to go back to work for longer, et cetera, because of a mistake. And that's where I see the potential for AI, again, back to that point, as co-pilot. They're not going to replace the doctor. Nobody wants to just go to Google AI and say, please prescribe what surgery I'm supposed to have, right? They want a real human that basically is providing that feedback. But that now provides tools. And going back to your analogy of toolkit and toolbox, it provides a whole series of new tools, diagnostic tools, to that physician that will provide, hopefully, more consistent experiences and more consistent answers to the medical problems that are facing people.
Oh,
Just to
absolutely.
add, Laurel, just another point out there is, if you see the American population today, the key problem, that or the key challenge that most of the providers or providers are facing today is in terms of the aging American population and the chronic diseases that follow with it. And that's a huge burden to the government in terms of, the Medicare population that they need to cater to. And that's where, generative AI kind of solutions come in with very personalized kind of an approach to analyze the patient risk level, to understand the patient as a whole in terms of not only his medical data, but data from unstructured sources, his social determinants of health data, his data from his past medical history or the past hospitalizations that he's undergone, the comorbidities data. So understanding the patient as a whole, analyzing the risk levels or, categorizing those patients at their right category of risk, and then providing those personalized interventions with the use of tools, as John mentioned, is where generative AI is going to play a role.
One point of clarification I wanted to have, Laurel. I'm assuming when Neha is talking about the aging population, she's not referring to me.
Of course not. No.
And we're going to edit that for sure, Lauren.
But that is a very good point that you bring up. Yeah, I mean, we do that baby boomer generation now. Yeah, is an aging, in air quotes here, aging population, and there are just naturally a lot of changes that happen within the body and one's health and over that course of time, and that absolutely brings a specific challenge to healthcare systems.
That would be another area of expertise I could speak to.
Well, we have a very multi-experience here going on today. This is great. We can bring a lot to the conversation. And I think it's just to dive a little bit deeper into that. I like that you did point out some of these misconceptions about AI replacing humans and things like that. And, what do you, I guess I should say just a little more into that, what are some of those primary misconceptions that people might have those knee-jerk reactions about, and maybe be more hesitant in trying to adopt some of this Gen AI into their systems?
Well, again, I mean, I think it all goes back to, we all grew up watching Terminator, right? We don't want the machines to take over the world. But, there are legitimate concerns, right? Because just like we don't want a physician today to diagnose us by going to Google and saying, "What is this disease?" Right? That would be a little uncomfortable to know that that's how our doctor prescribes medicine to us. Well, think of AI as sort of the next generation of that, right? We really want to make sure that there are thinking, trained, skilled people that are leveraging these tools and capabilities. And I heard somebody talk about AI, and I thought it was a really interesting point. They said, look, it's not going to be so much about AI is going to replace the need for people. It's going to be, and again, this is a generalized statement. Some jobs may not be needed to the same extent. Some more simplistic jobs may not be needed to the same extent in the future. But what they said is it's really going to come down to there'll be two groups of people: those who know how to do their jobs with AI and those who don't. Mm-hmm. And those who don't know how to do their jobs with AI will be at a distinct disadvantage. And that's what I would be encouraging people who are just starting their careers on and saying, hey, maybe you're going to have a career. Yes, you're going to have a career, but it's going to look a little bit different. And so understanding how to leverage these capabilities and tools is critical.
Mm-hmm. Absolutely.
And that's a very important point that John gets in. The primary collaboration that would be required is between the human and the AI. So differentiating or understanding what are the tasks that the AI will be doing and where is a human intervention would be needed in terms of validating the output of the AI is going to be of primary importance.
Right.
Well, and this raises a whole other series of challenges. If you think about it, the health plan executive is faced with. So, okay, I've got all of this great data, claims data, enrollment data, demographic, psychographic data about the patients that I'm treating. It's not as simple as saying, oh, let's just feed all of that data into Chat GPT, and now I have a tool I can use. Because there's a lot of privacy concerns, right, that you have with that data. So companies are still to this day struggling with, they're trying to catch up with what types of controls do we need to put in place so that our patients' data is protected and not made more widely available in ways that it shouldn't be. And if we have methodologies that are unique to our particular health system or company, what do we need to do to ensure that those don't find their way out in the public and we devalue what is the special sauce or the secret sauce that we bring to what we do? And so companies have not solved this yet. They're still thinking through it. And Neha, maybe you could speak a little bit to some of the things that you've seen us do to help health plans who are very, very sensitive about PHI data making it out to the public.
Exactly. And John brings a very important point in terms of the quality of the output, or in terms of validating the output that AI is generating. Now, there are data quality frameworks that have been put together to analyze this quality, whether the model is hallucinating, whether there are fallacies in terms of the output that is being generated. And there are layers of these quality outcomes that, at the source of data itself, whether the data quality is, at standards or at par with what the model needs to be trained on, whether the model that is being trained is generating the right kind of output or not. There are quality checks that are put in place once the model is trained in terms of whether the model is hallucinating or not. How do you eliminate those kind of hallucinations? How do you eliminate those kind of errors that are being generated once the model is in the test environment?
Right. Yeah. Experimenting with it first before jumping into that proverbial deep end and just rolling it right out. And, speaking to what you mentioned with the, a company or organization's special sauce, a question I'm going to throw out there, if it can be answered, what kind of experimenting have organizations done in general so far, on that front in regards to the security and the privacy of data?
One of the areas that I and a team that works with me have been focused on are every health plan has a significant number of benefits that they need to manage to. And, different co-pays, co-insurance, different rules. And particularly when you get into offering services like self-funded TPA services, every benefit in and of itself is unique to the company that you're supporting. And so health plans have forever struggled with this information. They haven't done a great job in putting it into nice, well-structured data. And so what we've done is we have created some capabilities where we can take the PDF versions of those benefits that they have to provide to every member as part of the Affordable Care Act regulations. And we've said, well, look, there's an opportunity for us to take that non-structured data and actually interpret it, read it, and then structure it into a database. And once you do that, you can do a bunch of things with it. You could use it to feed your call center applications with structured responses to questions. You can use it to actually update your claims adjudication engine by coding benefits directly, as opposed to having humans have to do all of that coding. And you can use it as a quality assurance tool to make sure that, in fact, the benefit information is consistent from your PDFs to your customer service applications to your claims adjudication engine. And so that's one example that we're working on right now, and actually have been showing some pilots to some of our
That's right.
clients.
And primarily, focusing on three specific areas is what most organizations are looking into. One is, how do you get generative AI use cases within your existing processes? So within the existing internal processes that we have in terms of our HR policies, in terms of the existing knowledge repositories that we have, how do we get generative AI and get those right kind of output? So experimentation around your internal processes is one area. Secondly, getting the co-pilot or getting human productivity. How do you get efficiencies within your existing projects or existing deliveries, where you analyze the differentiate the kind of productivity that a co-pilot can get in versus a human, and pick up specific areas within the delivery processes to experiment on getting in co-pilot in picture. And thirdly, in terms of actual clients, which business areas within the client organizations can you target with to go ahead from a proof of concept perspective. So those are the kind of experiments that most of the organizations today are getting into. And again, as I mentioned, at a very small scale is where we want to start with, and then scale further as the model evolves. As we speak, the model is evolving. So tomorrow there will be more areas which the model might evolve covering up with. And currently, there are certain limitations to what we see from the model perspective. So that's how the technology is evolving.
Wow. Yeah. It's and it feels like I feel like it seems like such a new technology, such a new thing when we talk Gen AI, but it's not. I mean, when you start giving examples, there are so many things that it's already doing, already in the field of healthcare. And beyond the data quality and ethical considerations, security, what are some of the pressing challenges that payviders have when it comes to introducing Gen AI into their operations, such as change management and user acceptance?
Well, I think first, the first challenge really is what we talked about in identifying what are you trying to accomplish. So think about it as a business problem, not as a technology problem you're trying to solve. If your focus is efficiency, that will take you one path. If your focus is accuracy, that will potentially take you a different path, right? And so if your focus is the reduction in the amount of time that it takes for somebody to answer questions, or the amount of training that you have to do for that individual, again, that's going to take you yet a third direction. So I always encourage people, what's the business problem you're trying to solve? Know that first, okay? Once you know that then what grows from that, of course, is what type of data is needed to solve that problem? Where do I have that data? How confident am I in that data? And how secure does that data need to be? Because if you're going to be working with data that's actually going to take member claims information, right, protected health information, and make that part of your AI tool, the level of security that you need to put in place is significantly higher than if all you wanted to do was use AI to analyze your benefits, because you publicly make that information available anyway in many cases. And so you don't have to be as worried at that point about the security of that data. So that's generally the way I view solving that problem.
Oh, that's perfect. Yeah, starting with why. What is your problem? What are you trying to solve with it? And thank you for laying that out and sort of mapping that out for us, because that makes perfect sense. And I mean, are there, I suppose, do you have any case studies, if you will, of how payers have successfully leveraged Gen AI to improve patient care and operational efficiency, like how this has actually been used, so far to date?
No, I wouldn't want to cover the case question, John. That's why, because we have not implemented this, and it's not a case study as such that we want to project. So it's all at the POC stage. I can talk about the HR policies. I can talk about our internal knowledge where we've implemented this.
So from a business case perspective, every health plan has to manage benefits. Those benefits in some cases, have to be filed with the state or the federal government, depending on the line of business, or are highly customized to an individual client if they're a third-party administrator or self-funded plan that's being administered. And payviders generally are involved in all of these: Medicare, Medicaid, ACA, Affordable Care Act, as well as self-funded and commercial insurance. And so they have to account for all of these types of benefits and the rules associated with them. What they also have to do in terms of creating the products, making those products available to the members through pre-designed PDFs, is they also have to code those benefits in their claims adjudication engine so that the claims adjudication engine takes the proper code, pays the proper deductibles, coinsurance, pays the provider the appropriate amount of money, identifies what type of process or procedure is submitted on the claim. And so all of that coding is a very important part. You can imagine the challenge in keeping that all aligned. Right? So I create a benefit. So that's done by a product management person. Okay, they usually work in marketing. That product then has to be filed. That's done by a regulatory compliance person. All right. That product then has to be presented in a PDF. That's generally done by an operations person. That benefit then has to be coded in their system for claims. That's generally done by a different type of operations person. Mm-hmm. Well, it doesn't take a genius to look at that and say, do they ever become disconnected? Of course they do, right? And that creates all kinds of problems. So by leveraging a tool like artificial intelligence, and by being able to take that information as soon as it gets documented and read it in and structure it, you can auto-validate that in each of those steps of the process, it's happening consistently and as it should. And you can reduce error by having the structured data that you've just converted by the unstructured data that you just converted structured data, by having that actually auto code the claims system so that it's properly administering the benefit. We have a demonstration now where we take a PDF, we convert it using artificial intelligence, natural language processing. We then put it into a structured database. We then take that structured data and generate code that auto sets up the benefit in the target claim system, all being done by technology, as opposed to the old-fashioned way, which is kind of handing the paper down the various departments and having people key it in.
Mm-hmm. And that's the theme that I've heard throughout our discussion today is the AI is this thread that is stringing together these different departments or different areas of hospitals and providers and clinicians and keeping everything together and cohesive, but also adding so much more efficiency to everyone's job
Absolutely.
too.
Right.
That's perfect. And so I guess if we are betting big on Gen AI in healthcare, what are your individual predictions over the next 5 years? Neha, we'll start with you on that one.
Sure. So from my perspective, generative AI holds tremendous potential. I think it's here to revolutionize the entire healthcare industry, right from your accelerated drug discovery and research to any kind of medical research which is required for your medical academics, or provider-based research which is required for your treatment plans, helping administrative staff, or changing the entire operations in terms of getting in more productivity or efficiencies in the way providers or payers are currently working, is going to be a big impact area for generative AI coming in, assisting physicians in terms of helping them clinical documentation or clinical decision support at the point of care, understanding the entire population, profiling them at their risk levels, and creating those personalized care pathways or care plans for the population. It's another area which is going to be a major impact from the clinical perspective. And at the back end, managing the entire call center operations, early response times, avoiding those call waiting times or restricting the longer waiting times for any member or patient queries, replying to those complex queries by generating summarized view of the information from unstructured databases at the back end, helping do human conversations, natural language understanding, and helping human conversations, analyzing data, improving the overall experience, not only from the payer provider, but also from the patient perspective, and eventually helping access, better access to care, convenience of care, as well as improving the overall patient outcomes, is where generative AI is going to play a major role going forward.
Yeah, so my prediction is that data-intensive aspects of our business will be prime targets for AI solutions, not as a way of replacing, as we said earlier, people, as much as a way of providing tools that allow those people to become more productive, more accurate, more consistent in doing their jobs. I know that everyone has rushed to the easy solution that, we're going to replace all the call center reps with bots and they're going to answer all of the questions. I promise you that companies that go down that path, there will be competitors that very quickly recognize that those are imperfect solutions and that people will want to be able to get to humans and talk to a real human to solve problems. So I would tell any business leader that's looking at that to proceed with some degree of caution there, because you might think, look how much money I'm saving. I don't need call center people anymore. And your clients might say, great, you also don't need me anymore, right? Because it's not giving me the experience I'm looking for. But the other thing I would add is I would say we really need to think in terms of change management. How do we train up our existing skilled people to use these new tools? How do we build them with them in mind to make their job easier? And how do we invest in getting them to change their processes, the way in which they do their job, to take full advantage of these tools? And I think if we do that, it will be embraced, and we'll all look back on the early days of this and say, wow, that this wasn't as scary or perhaps as we're all still doing many of the same things we do today, albeit we have significantly greater tools in our toolbox to basically support our clients.
Right. Yeah. And thank you so much for kind of clearing out some of those misconceptions and talking about those things. I think they're really important. And it's sort of like that initial reaction some people might have, some executives might have when they're like, okay, well, I want to implement this technology, but things might seem a little, scary, quote unquote. And I think when we look at Gen AI in healthcare organizations as, again, the co-pilot, the helper, the toolbox, the ally to help make the job easier, more efficient, help connect, I think it makes it a lot less scary for sure. So I really appreciate your expertise and just your conversation today and having this discussion with me. It was a real pleasure.
Thank you, Laurel.
Thank you so much.
Laurel.
Thank you for joining me.
Of course.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.